Assalamu alaikum. We'll start with the clinical cases with Mrs. Brandon, 35 years old female, present with palpitation. Ready to start?
Yes,
Dr.
let's
start.
start.
Dr. Abdulmanam?
Yes, I'm ready.
Okay.
Okay, here you go.
Okay. Hello, I'm Dr. Abdullah. I am a doctor in the clinic today. You are Mrs. Brandon, 35 years old.
Yes, doctor, correct.
Hello, Miss Brandon. Miss Brandon, today our meeting to discuss you about your medical issue. Is that okay for you?
Okay.
It came to my knowledge that you are complaining of awareness of heartbeat. Can you tell me more about that?
Yes, doctor. My problem started like 1 month or 2 months ago, when I feel that my heart just fasting and it's about to jump out of my chest. And I went to my doctor and he referred me to you.
Sorry for that, and I will try to help you. This started suddenly or suddenly?
Yes, doctor.
Okay, this is the first time to get like this complaint.
Yes.
Okay, and it is this awareness of heartbeat coming sometimes or all the day with you.
I didn't notice actually.
Okay, you notice anything increases like exercise?
No.
Okay, anything decreases if you take rest or uh,
No, doctor. Nothing specific.
okay, uh, okay. This but associated with any difficult breathing?
Sometimes, doctor.
Okay, when this difficult breathing, you are feeling more with exercise or with uh, daily activity or
No, it's just like combined with this palpitation. When I feel this, my heart racing. Sometimes I feel I have shortness of breath at the same time.
Is it regular this awareness?
I think yes, doctor.
Okay. Is it fast or slow?
Yes, fast.
Okay. Also, is associated with any chest pain?
No,
Okay. You have any difficulty breathing when you are lying flat,
no, doctor.
or you are walking from the sleep searching for air?
No.
Okay. Do you have any chest tightness?
No, doctor.
Do you are feeling dizzy?
No,
With this palpitation, you are not feeling dizzy.
no.
Sometimes you are feeling you have shakiness in your hand.
Sorry?
Any shakiness in your hand?
Yes, actually, doctor, I feel this. I have noticed this sickness. I think 1 week after this heart racing. And from at the beginning, I thought this because I have been passed for difficult situation. I thought this is of course of stress, but it's still I have this shakiness, doctor.
Okay. You have any stress, any stressful condition, any problem in your job or in your life?
No, at all.
Okay. Do you are feeling any hunger pain sometime also associated with this awareness?
No.
Okay. Do you have any change in your weight?
Yes, doctor. I lost like about 3 or 4 kilograms at the last 3 months. In spite of I tried many times to lose weight, but I still have this weight loss.
And what about your appetite?
No change, I think.
Okay. Any lower leg swelling?
No.
Okay. Do you have any neck swelling?
Yes, doctor.
When you notice this neck swelling?
I think just 1 month before this heart racing.
Okay, it is started so gradually increasing.
Yes.
Do you sought any medical advice?
No.
Okay, any weather preference?
Yes, doctor. I prefer stay in cool places. Even my
Mm.
colleagues that they think the weather is good, but still I need to work for air condition, doctor.
Okay. Do you have any raised temperature?
No, your patient in the group, the photo of your patient.
Okay.
Mhm.
طيب any feeling tired?
Sometimes, yes, doctor.
Anyone told you you are looks pale more than before?
No,
Okay. Uh, uh, okay. Do you have any skin rash?
no.
Any skin change? You are feeling this? You have more moist skin, more sweating?
Sometimes, doctor, yes.
Okay. Um, okay. Do you have any headache,
No.
blurred vision?
Yes, doctor. I
Mm.
noticed this, I think 2 weeks ago when I was driving my car. I feel this, my sight is not that good.
Your side, you are bumping the side?
No, no, no.
Mm. But your vision blurred?
Yes, yes,
Mhm.
impaired. I feel it's
Okay.
impaired, not like before.
Okay. Do you have any loss of consciousness?
No,
Okay. Do you have any tummy pain?
no,
Any change in your bowel habit?
no,
Okay. Any yellowish discoloration of your eyes?
no.
Uh, what about your water work?
What about it,
Any
doctor?
change in amount,
No,
color?
no,
Uh, okay. Do you have any uh, pain when you are combing your hair? You are feeling
no,
pain?
no, no
Okay.
pain,
Any
doctor.
mouth? No pain. Okay. Do you have any past medical history must be aware of? Any high blood pressure?
No, doctor.
Any high blood sugar?
No,
Any history of gland disease?
no,
Okay. Do you have any surgery?
no, doctor.
Any history of blood transfusion?
No,
Any family history of node?
no,
Any family history of gland disease
no,
or history of cancer?
no.
Okay. Can you show me your medication list?
Just I'm taking this paracetamol for my tiredness, doctor. But it didn't help actually.
You think help? Okay. Sorry
Mm.
for that. Do you are using any over counter?
Apart from this paracetamol, no.
Only. Do you have any drug allergy?
No.
Okay. Can I ask you some private question? I am asking for all my female patients. What about
Okay.
your period? Is it regular?
No, doctor. Actually, I felt like canty than before.
Mm.
And also, I have this missed period. And last
Mm.
month, I did a pregnancy test, but was negative.
Okay. And when is the last delivery for you?
My youngest baby, I think, like 4 years.
Okay. Do you smoke?
Yes, doctor.
I ask you how many cigarette per day?
Like 10 cigarettes for the last 10 years.
Okay. And I ask you to stop smoking because it affects your life. Do you drink alcohol?
No,
Okay. Do you drive, Mr. Bar- uh, Brandon? Do you drive?
Yes. Yes, doctor.
I advise you to stop driving until we will assess you and we'll check about your vision. Okay. Okay, Miss. Do you have any travel history?
No.
Okay. 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 Can I examine you?
Of course. What do you want to examine?
Okay. General looks of the patient. It is like okay. Vital sign.
Blood pressure 140 over 90. Pulse rate 95.
Hmm. Regular.
Yes.
Okay. Type hand examination. No clubbing. There is moist skin. There is sweaty hand.
Yes.
Okay. Eye examination. Patient not pale, not jaundice. Okay. Visual acuity.
Normal.
Visual field.
How you are going to examine the visual field?
I will close my eye and I will put my right hand. I
Okay,
will
okay,
ask the
normal,
patient.
normal,
Okay.
normal.
Okay. H shape also normal for the eye
There is
examination.
some sort
Okay.
of pain
Pain.
in eye
Okay.
movement.
Okay, I want to examine for exophthalmos. I will come from the right side of the patient and I will see from her right side, there is exophthalmos,
Mm-hmm.
lead duck, and red
No
rectus.
lead lag. No lead lag.
Okay, there is exophthalmos.
Um, her eyes is just like looks like the image in the group.
Okay, mouth, any mouth sore,
No.
any, okay, any, okay, the neck, I will ask the neck for this swelling. I will come behind the patient. I will check for, from in front, I will see I want water. I will ask the patient to take a sip of water and I will look to the swelling of the thyroid moving with swallowing. Okay, I will come from behind. I will examine the consistency. Is it firm?
Yes.
Consistency. Is there is any what multinodular goiter? I mean, any multiple swelling or one
No,
swelling
no.
only?
Diffuse homogeneous
Okay.
enlargement of both thyroid loops, thyroid
Okay.
gland
Not
loop,
okay. Not tender
not tender.
and no cervical lymph node swelling.
No.
Cervical anterior and posterior.
Yes.
Okay. And also I will tab in the upper chest.
No
Percussion
extension.
node. Okay. No extension. I will heart. First and second heart sound and no added sound.
There is third heart sound.
There is third heart sound.
Mm.
Okay, there is any basal crackles?
No.
No lower limb edema?
No.
Okay.
2 minutes left.
Okay, what is your concern, Miss Brandon?
My concern, doctor, what is wrong with me, doctor? And I tried many times to get pregnant without any I couldn't conceive for the last couple of years. Is it can be reversible, and is my condition is treatable or no?
Okay, I appreciate your concern. Most likely, Miss Brandon, you have a condition called Graves' disease. This Graves' disease is a medical care for medical condition that the defense system mistakenly attack your thyroid and cause for you this symptom. Okay, like that you have. Now I will do
Again, sorry, again, sorry.
a medical term for medical condition that the defense system attack your thyroid gland and pause for you this symptom. Okay. Now I will do for you some blood investigation and some imaging to confirm my diagnosis and to exclude other. And I will involve a group of specialists like gland doctor, specialized nerve physician. Okay. And also about it is serious. This is a serious condition if not treated. And it is treatable. I think it is. I appreciate your concern. I think it is controllable and not treatable. And about that, you are you are not getting pregnant. After controlling for this, I will refer you for a woman doctor, and also with the treatment and with the follow up with the woman doctor. I hope we will try to for your planned pregnancy. Do you have any more concern, Ms. Brando?
Yes, doctor. Actually, I have one last concern, doctor. Are you going to admit me or no?
Now, for me, your condition is stable. We can follow up you in our OBD. Okay. To now, I will keep you with me. I will run for you some blood investigation. Then I will follow up with you. Okay. After investigation, I will come and I will update you about my last decision. If you not admission now, or I will give you follow up in our clinic.
Thank you, doctor.
Okay, time is up. Start to examine the patient.
Present your case.
This 35 years old female presented with palpitation, and she has also some shortness of breathing, and she has thyroid enlargement with eye change, also exophthalmos and is with eye change and blurred of vision, and she has sweating and fine tremor, and she has scanty period, and on examination, patient looks she has a neck swelling with exophthalmos, and she has in the heart there is also low lymph node detected, and in the heart there is. You said to me she has galoprism or what?
Yes, left heart sound.
Okay, for that, okay, most my differential diagnosis, Graves' disease.
How you are going to help this patient regarding her job? Did you ask about her job?
Her job? I forgot.
Did you ask about her job?
I forgot to ask about her job.
No problem. No problem.
Okay, but if she has any problem, I will inform the occupational health to help her.
Doctor, you didn't ask about job, so you can't offer help without asking. So, what is your differential diagnosis for this patient?
My differential diagnosis is Graves' disease or hyperthyroidism.
Yes.
And maybe also for this palpitation, maybe due to cardiac causes.
Regarding the hyperthyroidism, is there any other possibilities?
Really, thyroid cancer, but there is no no constitutional symptoms, no
in general, what are the causes? What are the causes of hyperthyroidism?
In this patient?
Generally, what are the causes of hyperthyroidism?
The most common cause of hyperthyroidism is Graves' disease. Also, toxic multinodular goiter and toxic adenoma. Okay, and also thyroiditis or postpartum thyroiditis, but patient she has no recent delivery.
Good, excellent, excellent. So what other possibility regarding the palpitations?
Also maybe pheochromocytoma, but
Yes.
I didn't feel no what
No characteristic of pheochromocytoma.
no,
Okay.
I didn't.
Yes, there is no not coming in attacks or like that. So what is your management plan? How you are going to investigate this patient?
Okay, I will start with general investigation. I will do for her full blood count, liver function test, renal function test, inflammatory marker, including ESR and CRB. And I will do for her, for a specific investigation, I will do for her thyroid function test and thyroid autoantibody. And
which type of autoantibody you are going to conduct?
Anti-TSH and anti.
What is the name of antibody, doctor?
Anti-thyroid stimulating hormone and anti ما باسمه anti did
No
remember
problem.
the name.
No problem. Okay.
Okay,
What else?
and also I will do isotope scan and we'll do a thyroid ultrasound, and if we can take fine needle biopsy also.
Is there any indication for biopsy?
No need for biopsy.
So
but
this
no need to remove. Okay.
No need. Yes. No need. No need. Yes. What is the treatment?
Okay, non-pharmacological. I will start with, I will educate the patient about the disease and I will counsel her. I will refer her to multidisciplinary team. Pharmacological, we can start with the Markazole, and we'll give her also beta blocker to for her palpitation and other symptoms. Also, we can do for her radioisotope scan, and also we can do for her surgery. Okay.
What do you mean by radioisotope scan? For treatment or investigation?
No, I mean radiotherapy. Radioiodine. Radioiodine, yes, radioiodine.
Okay.
Yes.
Okay. So
also for eye, also I will refer her for the eye doctor about her vision problem. Okay.
Okay. Thank you, doctor. Now you can go to the next station.
Thank you, Dr. Intisar. Are you done, Dr. Abdelmanan, with question?
Yes, nothing more.
Yeah. Okay, you can comment now.
Actually, she did very well, very great. Actually, I think she covered most of the case. She missed a little things like her job, and impact of the disease. She forgot about. Yes.
In the exam, it is not a little.
Yeah, exactly. لكن البرفورمانس بتاعي كان جريت، فما ممكن نخصم منه حاجه بسيطه كده. ف في الهيستوري you ask about dizziness, but it's better also association of palpitation. You should ask. It's more wise to ask about syncopal attack, because very important as in palpitation. This if irregular, this is can cause can cause ineffective cardiac output and can cause syncope. You ask about anxiety, but I think in this case it's more appropriate to assess her mood. If her mood, because one of the complications of hyperthyroidism is an anxiety disorder, and related to even sometimes it can cause divorce, right? So it's very important to assess the mood. You did regarding GIT, the most important symptoms, lose motion, and you didn't ask about it.
I asked, but you said to me no.
Lose motion.
أي والله. I asked
Okay.
يعني any change in your bowel habit. You said to me no.
Okay. So my bad. في المسكولوسكليتال you ask about tiredness, right? And the shakiness of the hand, difficulty combing on your head, specifically for combing for proximal myopathy. You have to ask specifically for proximal myopathy, like difficulty combing your hair or no, or changing or standing from the chair or something like that. You should offer in this patient specifically. You should offer fundoscopy. Very important, because this patient has blurring of vision. She has eye pain in the examination. It's very important to ask to offer fundoscopy, because one of your clinical judgment. I have just a small comment on your clinical judgment, because this patient had heart palpitation and eye symptoms. In clinical judgment, you must tell her after examination of the disease, you need, and then we need urgently to be assessed by eye doctor urgently, because one of the complications is can cause back pressure and can cause optic atrophy. So in clinical judgment, this may affect your score in clinical judgment. You need to urgently refer to ophthalmologist and trace your heart, because her main complaint is palpitation. So in clinical judgment, you should mention this for the patient. Regarding the compression symptoms, patient has neck pain, you must ask about compression symptoms. You ask about shortness of breath in systemic review, but specifically change in voice and difficulty with swallowing. Yes,
Okay.
you should do it. Otherwise, you did everything is perfect, and no other comment for me.
Yeah, thank you, Dr. Abdulmenem. Very nice case and very common one.
Yes.
And well done by Dr. Ansar. Please, Dr. Abdulmenem, write your scenario down in the chat box. And I will give here some comments, okay?
Okay.
Yeah, to write the scenario down in the chat. Okay, Dr. Ansar, you did well. Apart from some question, it might help you in the clinical judgment, as Dr. Abdulmenem said, the difficult swallowing, the eye problem or urgent eye intervention, and the compression symptoms in general. You have to ask about these things, because you might admit this patient based on these symptoms. Once she will ask you, doctor, will you admit me? This one will be in the clinical judgment. Or you have to tell her, we will admit you. This is another clinical judgment. So be ready for this question and be ready for this decision. You might tell in the admission or in the management plan, one of the most important things to admit this patient. Why, doctor? He will ask you, the examiner, for what? So you have now reason for admission for the eye. If the eye exophthalmos, keratitis, exposure keratitis, or any complication popping out the eye, these are the indication for urgent referral to ophthalmology. Plus the diplopia and lid lag, all these things will be indicated for ophthalmology referral or any vision affection or a color affection. Okay, this is for the eye. The second indication will be for the gland itself as a compression signs, either compression on the esophagus, dysphagia, or difficult swallowing, compression on the trachea. It might lead to stridor or difficult breathing. Vocal cord, of course, also as stridor. So you have to ask these things. I remember last week or 2 weeks back, we received patient in ICU post thyroidectomy, the gland retrosternal extension down to the pericardium or mediastinum. Imagine how the patient is suffering from the symptoms. He's not suffering from the symptoms of a gland. I mean, Graves or hyperthyroidism. He was euthyroid patient. But the compression symptoms, the things bring the patient to the GS team and they operated him. It was compression symptoms, short of breath, and difficult swallowing. and the gland was extending downward till the mediastinum. So remember this thing whenever you have hyperthyroidism patient, especially the Graves one. Multinodular toxic also very common also to have this extension and enlargement. Apart from this, you have to ask also about any history of infection, roll out subacute thyroiditis. This is important for the differential because if no reason, you will differentiate this patient as Graves' disease. You have to ask about any sore throat or any recent infection for subacute thyroiditis. As you ask for postpartum, a very important question. All female history in this patient is very important, related to the period or pregnancy or even delivery. These things will guide you. Is it postpartum and is it hypo or hyperthyroidism? Okay. Apart from this, the whole systematic review, I think you did it well, and you cover everything, the pulse, and sometime also you have to ask for other association of autoimmune if you have autoimmune suspected disease. In this patient, you can ask about diabetes, any feeling thirsty or polyuria, feeling going to the washroom frequently. They like too much to ask for the association rather than the disease itself. The examiner nowadays, they are not thinking about the pure disease or the clear diagnosis. No, they want the candidate to enumerate what's the association and to ask about the association. And in the examination, you ask about what you might find and what the patient complaining for. For example, if this patient complained during the history taking about short of breath, you have to examine the chest, front and back, and also you have to examine for retrosternal extension to rule out compression over the trachea. Even if it's not there, just do tapping over the sternum to show the examiner that I did this and I did that. The topic of thyroid is very large topic. I can't go through the whole investigation. I guess you cover most of them. The management plan, but questions also very important here. The radioiodine as medication, I mean, what the indication and what are the contraindication, what are the social important question to you have to stop this patient for, like driving, one of the important, plus the smoking. Smoking worse the eye symptoms, and for the welfare, you have to stop him driving or her driving. Again, the topic is very large, but you have to remember in acute state or acute presentation, patient might come as thyrotoxic crisis. You have to start ABCD approach. You have to start the answer like this. Multidisciplinary team, if the patient came in acute attack, we have to think about ABCD approach, airway, breathing, circulation, and so on. What if the patient has compression signs? Up to thyroidectomy, you can do thyroidectomy to release this obstruction if there is difficult intubation. If you finish the acute presentation, you can go to the chronic, started by antithyroid medication, beta blocker, educational and some social support, the eye, counseling and education, and so on. Okay, I don't want to go more through the deep details because the topic is important from the A till the end. I mean, from the start till the end. Every question you might have this question in the exam. Okay, let's go to the next scenario. If anyone has comment before going.
How we can answer for concern of I will be pregnant, I try many times.
Yes, your answer was good, related to the woman. Doctor should be there. You should be controlled from the gland itself before arranging a pregnancy or a safe pregnancy. As you did. Anything not related to you, don't answer by yourself. You can mention safely the subspecialty and you will get the mark. Once you start to give information and you are correct or wrong, they might deduct you. Sometimes they can give you the mark, but they also can deduct you because you didn't call the concerned team why you are managing her pregnancy. you should include the endocrinology team along with the woman or the obstetric and gynae team, right? So be diplomatic in most of the answers. They don't want you to give everything and to manage everything by yourself. Sometimes calling the concerned team, this is the answer. And if you answer apart from this answer, they might deduct your mark. Clear? Yeah, gallop breathing because of heart failure. Patient has signs of high output failure. Dr. Abdulmin, I'm ready. The case is written there.
Yes.
Mrs.
The Basim, no other signs of failure. It's only gallopressin
And the heart?
for this.
Tachycardia, AF. Yeah, there was no. But you have to ask about the rhythm because it might be AF. Most of cases of thyroidic causes having AF. So you have to examine the pulse and irregularity. And you have to mention also the ECG and echo
And can
for
we
the
have only
investigation.
in heart failure? Only the
All
finding?
patient will be in heart failure.
Yes, it's only the gallopressin is only positive finding, no other finding.
You can find raised GVP, you can find edema.
Okay.
You got it?
Okay, thank you.
Most welcome. So you have Mrs. Leah, 32, with complaint of fatigue. You are the senior house officer in the medical unit.
Miss Layla, sorry, Miss Layla.
Layla.
Layla, okay. Miss Layla. Okay, I will read the comment until you be ready. Dr. Abdul just let me know.
Okay, we can start.
You can start? Okay.
Yeah.
Yes. Dr. Abdul wrote here, yes, third heart sound because of tachycardia and hyperdynamic circulation. Yeah, it's called high cardiac output failure, as in most of the endocrinology disease. Okay, let's start.
Yes.
Here you go.
Hello, my name is Dr. Ahmed, one of treating doctor in clinic today. May I confirm that you are Miss Layla, 32 years old?
Dr. Intisar. Wait, Dr. Aminam, she's not unmute.
Sorry.
Yes.
Yes,
Okay,
I
and
am
we'll
Miss
start
Layla.
again. We'll start again.
Sorry.
No problem. We'll start again. Yeah, here you go.
Hello there, my name is Dr. Ahmed, one of treating doctor in clinic today. May I confirm that you are Miss Layla, 32 years old?
Yes.
Miss Layla, we are here today to discuss some issues related to your health and examine you. Is it okay with you?
Okay.
I have a letter from your GP stating that you have been trouble with tiredness. Can you tell me more about that?
Okay, doctor. I have this tiredness started now about 3 months now. I'm feeling this tired.
I am sorry about what you have been through. I will help you as much as I can. Did it start sudden or gradual?
Gradual.
Is it the first time or you have a previous attack?
No, first time for me.
Have you noticed, is it related to any specific time of the day?
No,
From the start, is it increase, decrease, or the same?
increasing.
Have you noticed anything increases tiredness?
Any what?
Have you noticed anything increases tiredness?
Daily activity, yes. I cannot do my daily activity at home.
Okay, Miss Leila, do you have any pain, any parts in your body?
No,
Okay, how many steps you can feel tired before? How many steps you can manage before feel this tiredness?
not the steps, but I'm not like before. Before I'm doing only my daily activity, but now If I do something, I am feeling tired, I will come, I will take some rest, then I will go and I will continue.
Well, any weight changes?
Yes, I feeling that I gain weight.
How many kilos over how long?
For this I think about 3 kg.
Okay. Is this weight gain at the specific side of your body?
I think in my tummy more, but it is only in my body, but my tummy is more.
Okay. Okay. Well, do you feel sick?
No.
Okay. Miss Leila, any skin changes?
I think my skin become little bit dry.
Dry?
Yes.
Okay. Any rough skin?
No. Yeah. Little bit, yes,
Any
rough and dry.
sorry?
Little dry and rough.
Okay. Any puffiness around your eyes?
No.
Any neck swelling?
No.
Okay. Any muscle pain?
Muscle pain. I'm feeling tired only, but I'm feeling weak also.
Okay. Any difficulty standing from the chair?
Yes, I have difficulty, yes.
Okay. Any difficulty open the jars or open the door?
I feel, I don't know, I'm not sure.
Okay. Any bone pain?
No.
Okay. What about your mood?
I think I am feeling less mood. My mood is less.
That's less. Well, is this low mood enough to think to harm yourself?
No, no,
Any headache?
no,
Okay. Any heart and any chest pain?
no,
Any awareness of your heartbeat?
no,
Any cough?
no,
Any cough blood?
no,
Any weakness, any part in your body?
no.
Miss Leila, do you have any past illness I should be aware of?
Any past what?
Any
History?
past medical
No,
yes, any
no,
past
no,
medical illness you should be aware of?
no,
Okay. Well, what about your water work?
no, no.
Normal. Have you noticed anyone comment that you become paler than before?
No,
Any tummy pain,
no.
tummy distension?
Because as I told you, I become obese.
Okay. Well, any change in your power habit?
Yes, I feel sometimes I have hard too.
Hard stool. For how
Yes.
long?
This fatigue.
Okay. Can I see my patient?
I have no photo.
Okay. Well, can I ask you a private question if you don't mind?
Okay.
What about your period? Is
I
regular?
think regular, not regular. No, not came maybe 3 months.
Mm-hmm.
Not
Is
came
it
for
normal
me.
amount?
Before, yes, it is regular and normal amount, but for these last 3 months, I have no period. And I check my pregnancy, I'm not pregnant.
Okay. Okay. Well, any birth control? Are you using any birth controlling pills?
No,
Any pregnancy loss before?
no,
Any history of clots?
no.
Can you give me your medication list?
I'm taking multivitamin and paracetamol.
May I know the kind of paracetamol? I mean, the kind of multivitamin.
I took from the pharmacy because of this tiredness. I feel maybe to to relieve these symptoms of fatigue, but not relieve.
Okay. Any family? Are you allergic to any medicine?
No,
Any family history of similar condition?
no,
Any family history of note?
no,
Do you smoke?
no,
Do you drink alcohol?
no,
Okay. Do you have any vision problem?
no.
Okay. What is your job, Miss Leila?
I am a housewife.
So, and okay. So, as you mentioned that this affects your daily job and daily function of your body, daily function, right?
Yes, more.
Okay. Miss Leila, can I examine you?
Okay.
Okay. I would like to check vital sign.
Vital
Vital.
sign.
Mm.
Okay. My pulse is 50, 59, 50, 62. My
Mhm.
blood pressure is 90/60. And only what you want,
Okay. Well,
respiratory and
what about BMI?
BMI. Before is 20, now is 22.
22.
Yes,
Okay. Any skin changes? Look, still concerned about striae.
no stra, no stripe.
Okay. Any fat bags between the scapula?
No,
Okay. Okay. I would like to examine for proximal myopathy.
positive.
Proximal myopathy. Okay. Miss Leila, I want to ask you more one question. Do you have any weather preference?
Yes,
What do you
I
prefer
like
to
hot
stay in?
weather. I
Sorry?
like hot weather. Hot weather.
Hot weather. Okay. Well, um, okay. No neck swelling.
No neck swelling.
Okay. I would like to check blood pressure sitting and standing.
Yes, sitting, but I am sitting is I said 90/60. When I am
Mm.
standing, it is
Mm.
until 70.
70.
70 over
Okay.
40. Yes,
Okay.
there is a difference.
Okay. Any tanning of the skin?
No,
I would like to examine the mouth for hyperpigmentation.
no pigmentation.
No hyperpigmentation. Okay. I would like to examine the visual field and visual acuity and fundoscopy.
Nothing.
Nothing.
Yeah.
Okay. Well, I would like to examine the joints if there are any signs of osteoarthritis.
No,
Heart examination.
only bradycardia.
Okay. I would like to examine the lower limbs for any lower limb swelling.
No,
Okay. Any change in the color as general yellowish changes?
no,
Okay. Uh, okay. Abdominal examination for any organomegaly.
no organomegaly.
No organomegaly. Okay. So Okay, Miss Leila, I want to ask you more question. May I ask you about intimate relationship? Any problem in intimate relationship?
Yes, I have desire, decrease my desire for intimate relationship, really.
Okay. Any abnormal discharge? Sorry for this question. Any abnormal discharge from your nipples?
No.
Okay. So, what's your concern? What's your concern, Miss Leila?
What I have, doctor? Why I feeling tired like that?
I highly appreciate your concern, Miss Leila. From what you said to me, and after I examine you, you most probably have a problem inside the main gland in your brain. This gland actually controlling the gland in front of your neck called thyroid gland. This leads to reduce an important protein called thyroxine, given the symptom that you have. And this problem accompanied by loss of other important protein in the body may affect your period and even affect and this also affect the gland in above your kidney called adrenal gland,
2
giving
minutes
the
left.
symptoms that you have. What we need to do now is to admit you and to do some blood tests and specific imaging to confirm our diagnosis and to exclude others. Then we will sit together to discuss a proper plan of management, which done by a group of specialists involving of gland doctor, women doctor, and specialized nurse, and also social worker and woman doctor. Do you have another concern, Ms. Leila?
And what about my period?
This problem because of the deficient of important hormone, this secretion of important protein from the master gland in your brain called pituitary gland. And this deficient of important protein given this affect your period and irregularity.
Okay.
Do you have another concern or something you want me to repeat?
Okay, I will ask as the examiner. Okay.
Okay.
You have any other question, Dr. Abdulmina, you want to ask? Always remember the etiology and pathology. Why? Ask yourself why
Why?
this happened.
Why?
Yes.
ده أول سؤال
Surgical,
هسأله. Why?
Yeah, yeah.
surgical operation before?
No.
Okay, time is up.
Okay.
Yeah, let's start the examiner question. Yeah, start, Dr. Ansar, please.
So present your case, of course.
Okay, this is a 32 years old female presented with tiredness and all the time, and also she has weight gain and she has cold intolerance. Apart from that, she has yes, and she has cold intolerance, and she also, apart from that, she has irregular of secondary amenorrhea for 3 months. On examination, she is hypotensive with postural hypotension, and she has rough skin and dry skin, and she is bradycardic. Apart from that, she has symptoms of hypogonadism, and also she has loss of libido. Apart from that, yes, apart from that, she denied any headache or surgical operation. Disregard symptoms and findings.
Okay. What is your differential diagnosis?
My differential diagnosis for this lady, first differential diagnosis is pan-hypopituitarism.
Okay, what is the cause of panhypopituitarism?
To be honest, I didn't. I asked about compression, macroadenoma. She denied any headache. I asked about previous surgery. She denied any history of surgery. I didn't ask about radiation because she has no any past medical history. She denied any past medical illness.
Yes. Do you ask her about delivery? In the last delivery before 3 months and a half, she has very
she has
severe
she
Sheehan
has
syndrome.
Sheehan syndrome.
Yes.
Okay.
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 Okay, your differential is hypopituitarism. What else?
It is a hypothyroidism, but again, is that she has amenorrhea, which should be amenorrhea. She other differential, this is tiredness because of anemia, but denied, and there is no pallor. Also because of secondary hypoadrenalism.
Adrenal insufficiency.
Yes, additional disease.
Okay. 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 How you will investigate this patient?
This pituitary gland hormone, say prolactin, ACTH, and thyrotrophin releasing hormone, and this and thyroid stimulating hormone. Pituitary profile. Also, I would like to do a brain MRI.
Brain MRI. Okay.
Also, I would like to confirm I would like to do short thin test to confirm the addition.
Okay, and hypothyroidism and pituitary, thyroid, and adrenal.
And adrenal.
All full investigation plus serum electrolytes and
routine investigation, yes.
An MRI and basic investigation. Okay. How to treat?
Hormonal replacement. I will start with the steroids first, and then I will introduce thyroid hormones.
Okay. And also she is feeling tired also. We can give her, if there is tiredness like that, we can also check her growth hormone, and also we can give her, if needed, growth hormone. Okay.
Okay. Okay.
And also, you want to admit this patient?
Yes. Because of hypertension.
Hypertension also. Okay. Okay, doctor.
Are you done, Dr. Ansar, with question?
Also, don't forget that to tell about non-pharmacological. Educate the patient, counsel her, refer her for multidisciplinary team. Okay. For comment كويس يعني well done.
Yeah, you can
أنا
start
صراحة
comment.
يعني well done. أنا في الأول افتكرت أنت هتقول بس hypothyroidism، لكن كويس سألت عن بقية حاجات فيوجد. بس في الكونستيتيوشنال symptoms يعني مثلا التمبريتشر، اللمس بمص، الحاجات دي شوية برضو كان ممكن نسأل عنها، بالذات إنه عندك وقت يعني. تمام. لكن بقية الحاجات كلها غطيتها يعني. أوكي. ودايما يا هو في أي هيستوري لازم نحاول نعرف what is the cause, what the underlying cause, and confirm the diagnosis, and to ask also about complication and association. All these must be in the history and examination. And this is the problem really here. لكن بقية الحاجات تمام. Okay.
Okay. Thank you, Dr. Ansar, for the case. Yeah. Any other comment?
No.
Well done, Dr. Abdelnaim. And good occasion to bring the two scenarios opposite to each other. I mean, hypothyroidism and hyperthyroidism. And please, anyone attend this session to read the hypo and hyper. Sheehan syndrome, I think, yes, all of us know the condition. So let's start commenting as onset, course, duration. You cover all this question, but the gaining of weight, I guess you didn't ask how many, over how long, or you
I
asked?
asked.
No, no, he asked.
He asked, and yeah, and you
Mm.
ask where exactly this weight, yeah. But after that, you can ask what the impact of this weight. I mean, in another way, you can say about the complication of gaining weight. For example, the OSA, obstructive sleep apnea, might be there. Carpal tunnel also might be there, and osteoarthritis also might be as a complication. This is for the complication of the weight gain. Complication of the condition itself, hypothyroidism, bradycardia, all the things we can discover it while asking for the history and system review. The association, as Dr. Intisar said, you have to find the pathology, the complication, the association. It's very precious comment. Search for those, not only asking here and there. Believe me, they are not giving mark what you did. They are judging on what you missed. So what you missed here is underlying pathology. He might deduct your mark for that. So how you can give here diagnosis without asking about delivery, radiation, sometimes also infiltration, thalassemia, hemochromatosis. All this can be as a reason. So you have to ask all the things. Trauma to the head, radiation, as you said. Any possible cause can guide you to the reason you have to ask about. At least the commonest. So the commonest here is Sheehan syndrome and panhypopituitarism as macroadenoma or apoplexy. It could be also apoplexy, right? So you have to ask about any history of brain tumor or whatever, or any headache before. It will also help you to rule out panhypopituitarism after pituitary apoplexy. And the panhypopituitarism, the other cause and possible common cause is Sheehan syndrome. This is what we have in PACES. Radiation, lymphocyte infiltration, all these causes are very rare. They might bring it, but you have to rule out the common. We mentioned the common, both of them, either the Sheehan or apoplexy. You can add to them hemochromatosis and as infiltrative lymphocytosis infiltration also as a cause. Radiation, all the other cause will be in the bottom. But in the top, you have to ask about both Sheehan and apoplexy. Is that clear? Regarding the examination, as you did, from the hand, the pulse, all hypothyroidism you have to examine. The coldness, the dryness, skin, pulse, carpal tunnel, you have to examine all of these. Then you will go up for proximal myopathy. Then the eye, any affection to the eye. Don't miss the posture hypotension as in Addison here. It might be also associated. Can I offer sitting and standing blood pressure before going to the eye? The eye, as I said, you can ask for the acuity and visual field. Just rule out apoplexy. It might be also there. Trauma, you can ask, and you can also discover the scalp or explore the scalp or offer it. The eyebrows, loss of eyebrows, outer third, one of the hypothyroidism signs you have to ask. Then you will go to the neck, any circumference increase, any thyroid mass. You have to measure, or sorry, to examine the thyroid locally. As we know, all of us, the local examination of the thyroid. You have to examine it, and lymph node as well. Immediately while you are doing thyroid, do as you are asking for or looking for lymphadenopathy. Okay. Apart from this, in the tummy, you will also examine for Cushing, as you said, as a differential for gaining weight. The stria, but it's against our diagnosis here. It will be high steroid and high blood pressure. In the opposite side here, the patient is in the lower side, bradycardic and maybe hypotensive due to Addison syndrome or Addison disease. The leg, very important for edema, mixed edema, and also for dryness of the leg. Osteoarthritis in the knees while doing examination of the leg. This is regarding the examination, the association you mentioned, the investigation you have to mention, but I'm against the admission. Patient doesn't need admission. You can arrange, unless there is significant drop on her blood pressure while sitting and standing. So you suspect Addisonian crisis, for example, or hypoglycemia. You have to admit this patient. Apart from this, you can do the test or investigation in the OPD. I forget something in the previous case and in this scenario. Any mood change or any stress condition in the life, you have to ask about the mood, sleep, and stress. Mood and sleep and stress. Any patient has stress, you have to ask these three things. How's your mood? How is your sleep? And what's your stressful condition or what's your trigger? Okay. Apart from this, as a topic, investigation-wise, all hormonal assay you have to do from A to Z, FSH, LH, thyroid function, TSH, T3, T4, and even growth hormone, as Dr. Intisar said. And the first thing to be started for correction is steroid, then thyroid, steroid, thyroid, and lastly, the growth hormone at the end, especially if the patient has fatigue. I guess we covered the whole topic. The differential I mentioned as apoplexy and also the Sheehan syndrome, or you can say any panhypopituitarism due to radiation or whatever the reason. Hypothyroidism itself alone, you can't give here because the patient has loss or amenorrhea. In hypothyroidism, patient will have menorrhagia. So I guess it will be wrong differential if you said hypothyroidism only. So he will ask you, what do you think? Is it primary or secondary? Or you can say secondary hypothyroidism, but don't say primary hypothyroidism. Primary hypothyroidism, patient will have menorrhagia. Secondary due to hypopituitarism, yes, I agree. Any reason for panhypopituitarism will be as a differential in this patient. Okay. Thank you, Dr. Ansar and Dr. Adminam. Nice cases and very common topic in the exam. Let's, yes, very important. Delayed reflex. I'm always forgetting this. Perfect. You have to mention the delayed reflex, tender reflex. It will be delayed. In the opposite side, the hyperthyroidism will be brisk or exaggerated. Craniopharyngioma and MITS. By the way, craniopharyngioma is common in the child, or sorry, in the pedia, not in the adult. So I guess it's not that much common as we mentioned. Surgery, yes, he asked surgery and radiation. Sleep, mood, stress, yes, both together. SMS, okay, good mnemonic. Diabetes insipidus, DI. If the patient has polyuria, but I don't think here will be. Can we put autosomal or autoimmune polyglandular syndrome as the feature? What you find here, thyroid and Addison, vitiligo, diabetes. I guess it's not. So Addison, thyroid, could be.
Because pituitary is here involved also, I think.
Uh-huh. But it's clear, the differential is clear regarding the panhypopituitarism.
Yes,
Yeah.
going more with panhypopituitarism.
Yeah, so don't give differential away. Yeah, it can be, but they will think, why you put autosomal, autoimmune polyglandular syndrome if there is other differential and accept differential. Apoplexy is more accepted than this. And any cause of panhypo can be also there. Yes.
هو ايه المين ديفرنس بين الاوتومين بوليجلاندولار سندروم والبان هايبوتنتريس؟
What the main difference?
يعني هو احنا حابين نفرق ما بينهم ممكن
Okay,
مثلا
let's say Yeah.
اوتوميون جلاندولار سندروم بيبقى معاه دايابيتس ممكن يعني
Yes.
زي بلس او ماينس اديسون اصلا بلس او ماينس دايابيتس بلس او ماينس
Yeah.
ثايرويد.
Thyroid.
لكن
Yes.
ده هايبوثيريس ما بيبقاش معاه دايابيتس. كمان في حاجه
Yes.
الاوتوميون جلاندولار سندروم بيبقى معاها تانينج اوف ذا سكين. تانينج اوف ذا سكين الاس تي اتش بيبقى عالي. الاوتوميون جلاندولار سندروم بيبقى الاس تي اتش عالي لان المشكله اديسون مش المشكله فوق. لكن البان بهايبوثيريس بيبقى معاه alabaster سكين.
Yeah, as ACTH deficiency. Yes.
اه
So I guess, yeah,
مثلا لو قلنا
it's a way.
قلنا
We
ايه تاني؟
can't do.
ايه
We can't say this is differential. That's why I said no. It's far away. You have to give the differential of panhypothyroidism rather than giving autoimmune Burgerander syndrome. This is my opinion also. Yeah, Dr. Shaima also clarify the things. You might have diabetes more with APS, but here suppose no diabetes. And as we said also amenorrhea, there will, I think amenorrhea according to the thyroid state there, but here amenorrhea is mandatory. By the way, very important question, Dr. Almanem, you missed lactation. Did you lactate your baby after delivery? This is very important question. Failure of lactation going more with Shan syndrome. She will never lactate her baby. She will tell you, no,
Okay.
doctor, I give him by, yeah,
I want to
official
raise as a
milk.
concern, but I forgot.
No problem. Yes, always we are reminding each other. So this is important differentiation between primary or secondary hypothyroidism. Sheehan, specifically Sheehan syndrome. Sheehan syndrome, after delivery, patient will not have period, will not give her breast. Can't breastfeeding her baby, and as I said, amenorrhea, plus fatigue and so on. So don't forget this question. Any trauma, any blood transfusion after delivery? Was your delivery eventful? Did you receive any blood? Did you lose any blood? Okay, this is very important question. And by this type of question, you show the examiner, you impress the examiner actually, not only showing, you impress him that you are catching the underlying cause and you are pointing to the cause. And they like this. Okay, if you miss, they will minus you. As I said, they are not focusing what did you find, they are focusing what did you miss. So if you miss something important, they will minus you, whatever you find. Okay, if you found, for example, in this patient, all symptoms of hypothyroidism, Addison, and so on and so on, but you didn't discover the reason, what are the reasons of this? They will deduct you. Okay, so focus on the underlying pathology. No patient will come to you without pathology or without etiology. Yeah, he has a disease. Why this happened? You have to realize why this patient came to me. He's symptomatic, yes, but why the symptoms is there? You should explore more and more. And with the practice, you will know. If you practice Sheehan syndrome like today, you will never forget it again. Once you have female in the childbearing period came with amenorrhea or came with failure of lactation or came with hypothyroidism or came with posture hypotension, you should ask the female history. Then you will reach to the previous pregnancy. Some patient will have postpartum thyroiditis, so you will ask about any eventful or any symptoms post delivery. Delivery in paces, by the way, delivery in paces in two conditions: postpartum thyroiditis and peripartum cardiomyopathy, and both conditions coming in paces. And Sheehan syndrome. These are the three diseases in paces related to delivery: peripartum cardiomyopathy, postpartum thyroiditis, and Sheehan syndrome. Don't forget the pregnancy history in childbearing period. Always write it in a circle. Whenever you have female from 30 or even from 20 up to 50, you have to ask the female period, female question started from period, pregnancy, and delivery. Okay. And you ask good question also by birth control pills. Yes, good question to ask. But you have to explore other female history. If you target it, you will find the history. You will find the disease and you will know that the condition. Okay. Let's read the comments before going to the communication. Anyone has comment or question, please feel free to comment. Pituitary dynamic test. Okay, must mention for the patient that I will admit you and start steroid. Yes. But admit if the patient has hypotension, hypoglycemia, like this. One question will be asked by the patient. I can lactate again. Is it reversible? Yes. Good question. And also, can I conceive again? Yes, she can if you replace her FSH and LH. But also don't forget to mention the obstetric angina. Lactation, unfortunately, irreversible. As prolactin, you mean deficiency? Yes, the lactation is irreversible, but the period may be if inducted by the hormones. Amenorrhea with hypothyroidism could be pan-hypopituitarism or autoimmune ovarian failure as a part of autoimmune polyglandular syndrome. This will be differential according to the finding in his history and examination. Yes, and again, the lactation and the history of pregnancy and so on. Thank you, Dr. Nada and Dr. Muhammad, and all of you for the comments. Let's move to the communication. If no more question or comment, Dr. Aisha and Dr. Shaima.
اوكي انا هبعت السيناريو يا عائشة ماشي.
Okay.
Yes,
السيناريو
okay,
صح.
please. Yeah, write it
خلاص انا كنت
and I will share it.
بعته على
Yeah, please. Yes, okay.
بعته على
And please try to be talking English everywhere and every time. It will give you this confidence how to talk to the examiner. Okay? Okay. Counseling for warfarin side effects. Scenario, Mrs. Amira, 29 years old, admitted 3 days ago as a case of pulmonary embolism. The hematologist prescribed warfarin for her, the best interest for her condition. She read about the warfarin side effect on the internet, and she's very worried about this drug. You are the senior house officer in the medical department. You are asked to discuss this issue with Mrs. Amira. Dr. Aisha, 2 minutes, then we'll start.
Okay, we can start.
You can start. You ready?
Mhm.
Okay, reset. And here we
Okay. Hello, I am Dr. Mutwalli, the doctor of clinic today. May I confirm you are Mrs. Amira, 29 years.
Yes, doctor, I am.
Okay, Ms. Amira, we are here today to discuss about your health condition. Is it okay with you?
Yes, doctor. Please.
Okay, Ms. Amira, can you inform me how much you know and what query bring you to the clinic today?
Actually, doctor, I have been suffered from this clots in my lung. And the doctor prescribed to me medicine called warfarin, and I don't want to take it, doctor. I read about it in the internet, and has a lot of side effects. I don't want to take it.
I really appreciate your knowledge and what you experience in these last days. And yeah, I need to ask you if you feel better now.
Yes, doctor, I am much better.
Okay, Miss Amira. So can you tell me more why you want to take this warfarin?
As I told you, doctor, I read about warfarin in the internet, and I found this. It can lead to bleeding from nose, from mouth. It can lead to bleeding in brain, doctor.
Mhm. I really appreciate your knowledge, Miss Amira. And first, I need to know if you know about your uh, problem and why they prescribe this warfarin. Do you know any information about that?
Yes, I told you, doctor. I have been suffering from clots in my lung and
Yes,
shortness of breath.
mhm. And do you know the benefit of this warfarin in the condition?
Okay, it may dissolve the clot, but doctor, it can cause bleeding in my brain. I think
I really
clots in my lung
appreciate your
is
words.
more. Oh,
Yes. Let me explain more about this medication so you can decide about it. Can you let me explain more?
okay, doctor.
Okay, for your condition, Ms. Amira, you are really, we are really in danger that about this blood in your chest. It can be progress to more worse condition. It can close this artery again and causing like life-saving condition. In most best of interest that for your condition, the consultant decide about use this medication upon that it is most of patient takes the benefit from it and it rarely cause the bad effect with good follow-up and good precautions that we will give you about this medication. Yes, this medication can causing thinning of your blood, and this is the goal, and uh, this is why we give you this medication. Really, we need from your blood to be more thin to overcome the problems that you have in this in your situation. Are you following me, Ms. Samira?
Yes, doctor.
So for the benefit we will get from this medication that we will prevent more damage to your chest and to your heart and to prevent you from entering something serious causing your life to be in danger in some situation. And for the bad effect of this medication, we know about the bad effect or unwanted effect, but I assure you this with regular follow-up and the precaution we will give you for this medication, it will be very rare and we will monitor this closely and we will give you the contact for the health issues, for any health issue, for any queries, or anything you notice about the bad effect of the unwanted effect of this medication. Does this sound clear, Ms. Amira?
Yes, doctor, this sounds good, but it also interfere with many diet, many food, and many medicine, many other medicine. I cannot tolerate this. A lot of precautions.
I really appreciate your concern and this is really valid concern. And I know that this medication has a lot of precaution, a lot of information you should know. But I reassure you this we have specialized clinic for this medication that will regularly follow up you, provide for you all the information that you need. And really it can be hard in the start, but usually the patient after taking this medication for a week and week, they know more things about what they will do and be calm. We will keep following you. We are together in this journey and we will follow up you regularly. We'll give you all the instruction and the leaflets so you can review it regularly. And if you have any query about anything, you will have a contact number of this clinic so that you can raise your concern at any time so they can reply be in proper way. About the bleeding, I need to reassure you about we have this clinic they will check you every month by testing your blood if it is in the proper thinning way or you have any problem with. And we have medication to correct any problem if happened at any time for this medication. And this valuable was simple medication, and it is available always. Can correct what happened in a rapid way. And if the consultant sees that you have any risk of bleeding or any effect of this medication, he can decide about you another medication or can change it accordingly for the best of your interest. Does this sound clear, Ms. Amira?
Yes, doctor. Sounding.
Okay, so can I ask you what you do for living?
I'm a teacher.
Mhm. And are you in regular relationship?
What?
In regular relationship.
Yes, doctor. I'm married.
Okay. Are you planning for any pregnancy next month, Ms. Amira?
Yes, doctor. Yes, doctor. I want to be pregnant.
I appreciate your hope, but I really, I'm sorry to tell you, this medication is not allowed in pregnancy. So you need to be planned pregnancy, and we need to shift to another medication if you become pregnant. So please be followed up with a woman doctor so she can advise you about regarding that. And accordingly, we can change our plan if you become pregnant. Does this sound clear?
Okay, doctor.
How condition affect your job, Ms. Emily?
Actually, doctor, I'm quite well now regarding this clots in my lung, but I am very worried about watering.
2 minutes left.
Really, we will support you as much as you can, as we can, and also we can involve you in another discussion and another meeting if you need to know more.
Okay.
If you have any issue, please raise this contact number, and I will give you all the information directly about how you will manage this warfarin in your daily basis and what is the diet you should take, and also about please for any if you need to start any medication, you should consult the clinic of this warfarin, and also you should tell always the doctor, your GP, about that you are taking this warfarin. And please, if you have any bleeding anywhere or feeling uncomfortable or feeling any chest pain, please contact urgently the emergency facility. Okay, Ms. Amira? Do you smoke?
Okay, doctor. For how long?
Okay.
No, doctor, I don't smoke.
Okay.
For how long?
We still not decided about that. According to its case by case, and the consultant will provide you with the regular follow-up about the time we can stop this medication, or you should take for how long.
Okay.
Okay. Do you need any support? Do you need any support at home, Ms. Amira?
Thank you, doctor.
Okay. So, Ms. Amira, about your job, we will provide you, I think they provide you some sick leave that you can off of work till your condition become better.
You can provide me with sick leave?
Yes.
Okay, doctor. Thank you.
Okay, and I really advise you to start graded exercise at home and be aware about your health, about heart, if you feel any irregular beats or if you need any chest pain, please seek consultation directly.
Okay, time is up.
Okay.
Yes, time is up. Let's start comment. Dr. Shaima, please, can you comment?
ويل دان عائشة، بس هو في نقطتين صغننين مهمين، ان انت هتعملي لي ريفير للدايتيشن عشان تقولي ايه
Yes.
الالاو ومش الالاو، والحاجة التانية
كل ده في
الالكول.
الاي ان ار كلينيك مش في الدايتيشن، صح؟ ولا البورفين؟
لا
From
المفروض
now.
انت هتحوليني للدايتيشن من دلوقتي، وبعد كده انا هتابع مع الاي ان ار كلينيك، بس هتحوليني للدايتيشن.
I think dietitian have no role here. is like contraindication and the interaction with medication. He will not know about. I think it
ايه
is
معلش
in
علي
the
صوتك
warfarin
شويه معلش.
clinic. I
لا يا
think it's
حبيبتي.
in warfarin clinic because the dietitian not a doctor. He will not know about interactions. It is some of interaction here, not about diet and lifestyle.
لا
I think
دايتيشن.
I don't know.
لا
Okay.
هو حتى انا جايبه لك الحاله من دكتور الرص، كتاب الرص
Yes.
كاتب ان احنا ريفير البيشنت تو دايتيشن.
They
لان
know
هو عندهم
about.
لسته
Yeah, they
عندهم
know
لسته
about.
زي بالظبط الليسته بتاعت الهاي كربوهيدرات دايت، عندهم لسته اللي بتبقى انترفير مع الورفر.
Yes. Yes.
خلاص دي حاجه. الحاجه الثانيه الالكول، انا وغوشت عليكي قبل ما تسالي عليه وانت ما سالتيش.
هو
فالالكول
دي
مع
هنا
الورفرين.
important.
الورف
يكون في
الالكول مع
مشكلة مع
الورفرين.
الورفرين.
ان هو alter الورفرين efficacy. So this issue to be discussed with dietitian برضه. يعني انت المفروض تقولي اساليني ان انا درينك الكول ولا لا، او المفروض الالكول يقف او يقل لدرجه معينه، برضه الدايتيشن هو اللي هيقول عليه.
اوكي.
اوكي.
تمام.
بس ما شاء الله بقيت الحاجات انت عملتيها كويس جدا، بس انا مش فاهمه ليه سيك ليف وانا بقول لك انا كويسه يعني، وليه خليني اقلل الاكسرسايز يعني.
graded exercise ما قلتليش قللي. هو طبعا واحد لسه بالموني امبوليزم so will be
No, no.
included in graded exercise.
انا
Instead, you
بيتهيألي
can.
ده انا قلت لك ما عنديش مشكله. مش المفروض
Uh,
تأوفر بسهوله يعني.
Avoid trauma. This is the important, Dr. Aish. Not great exercise. If you want to advise related to or regarding exercise, avoid heavy trauma or sports.
for the warfarin, she has just 3 days have
For what? For
Yes,
what يا
but
دكتور؟
3 days ago,
risk of bleeding. I mean, any trauma might have bleeding.
and she can go to work with
Yes, she can go to work, but I mean for
pulmonary embolism. Okay.
no, I'm talking about the bleeding side effect, not about the pulmonary embolism.
Yes, I know, but I about the sick leave, she is
Sick leave.
now at hospital and she will discharge. So take sick leave.
Okay, if she asks, yes, as Dr. Shema said, if she asked you,
Okay.
Doctor, will you do something for my job? I have problem now. I didn't join. I can't go back.
او لما انت سالتيني حتى انت دلوقتي عامله ايه، قلت لك انا كويسه جدا ما عنديش
Yes.
مشكله. طب الشغل ده افكت يور جوب؟ لا انا في شغلي كويسه مفيش عندي مشاكل.
Okay.
خلاص يبقى مش لازمه بقى يعني سيك ليف تاني ليه، ما انا كويسه.
Yes, exactly.
Okay.
Exactly. By the way,
And about exercise also here not suitable to speak about.
yeah, it's about the heavy exercise or hobbies. Any hobbies you are doing, hiking, for example, avoid any trauma to your head, any trauma to your body, because you have some risk of bleeding. If you have any trauma,
Okay.
I mean. Okay.
انت
By
ما
the
شاء
way,
الله كلمتي يعني المفروض.
yes, continue. I will
Okay.
comment after you finish. Yes.
اوكي. هو احنا بس عشان نفكر بعض، احنا في الورفرين المفروض ان احنا بنعلق على النيو we will comment on new medication as you said, on diet, on pregnancy as you said. And if she asked about any alternative, there is another concern, any other alternative, doctor, I appreciate your concern. Warfarin was prescribed in the best interest of your condition by the blood physician, who is expert in such cases. Any other alternative to be discussed with blood doctor himself. عشان ايه لو هي if she asked you any alternative، هو في alternative طبعا، بس احنا ما دام مش مذكوره في السيناريو مش هنقدر نقولها. بس انت ممكن تبقى المخرج منها كده يعني البلاد physician هو اللي ايه can discuss with you any other alternative mode. بس يعني ما شاء الله انت عملتيها كويس. well done دكتورة عائشة. اتفضل يا دكتور باسم.
Yes, I will add only for the point of best interest. You have to mention the word best of interest or best interest for your condition. She might ask you for NOAC or DUAC. Yes, sometimes they are raising it as a concern at the end or before the end. Doctor, give me what's called NOAC. I hear my friend taking this medication. It's very easy, no monitor. And yes, I appreciate your knowledge. I appreciate your concern. However, the warfarin was prescribed in the best interest for your condition. Always give her as the best interest for her to show the examiner that you are following the task and also the consultant advice. Okay, so don't try to negotiate with her. No, it's not good. There is some medical. No, at all. Tell her I appreciate and go back to your task. Don't give her any chance to get hope to take other option or to get another option which is not the best interest by the consultant. You will be in trouble. Okay, this is regarding the point of alternative. Regarding, I will say that because I passed by this experience, the sick leave, medical report, in the case of vascular necrosis, I mean in my exam, this surrogate, he asked me, doctor, I have problem with my job and what you will do with that? I offer him a report. I told him, yes, I will provide you with a medical report and we might give you some days as a sick leave arranged by occupational worker. And I guess it's correct because it was full mark. So you can, if she insists or she asks or he asks you, doctor, I have problem with my job. I don't have ability to join back the work or whatever. Or if you ask him or ask her, are you okay? You are supported. How is your job? Are you able? If she said, no, doctor, I am not feeling well, yes, you can provide her with some rest or sick leave because you have the authority to give sick leave. It's your decision. For example, acute patient like PE, you can give her. But if she said, no, doctor, I am fine, okay, no need. If he said to me, I have a replaced hip, I should give him, of course, sick leave. How he will go with a replaced hip after 1 day or 2 day or even 1 week? So if the patient unable, you can offer medical report and you can offer also sick leave. Okay, safely. But if she's fine, no need to offer unless she asked that. Is that clear?
Yes, yes. Thank you.
Okay, let's go. Thank you, Dr. Aisha. Let's go. By the way, you did great. Well done. I will add also another comment. Please, any medication or counseling, you have to comment on 4 points. The dose, the route, and the frequency, and the complication or side effects. And you can add at the end interaction, if there is some interaction. A specific side effect, like investigation before TNF, for example, you have to do screening for HIV and so on. So the dose, you have to mention the route, it's oral, the frequency, how many, and for how long, and the complication. You might have some bleeding and some feeling unwell, rash, GI upset, or feeling sick, throwing up. You have to mention these type of side effects in any counseling about any medication. Sometimes the patient will take it and he will come back or he will stop it because of the side effect. And he will tell you, doctor, you didn't tell me about the side effect. So if you didn't counsel, you will be in trouble. The same as for the scenario of amiodarone. Patient will take amiodarone after a long time, he will come to you, doctor, I have cough. You will be in trouble. Why you didn't tell him about the cough? Isn't it? It's the same concept. Why you didn't tell him about side effects? So it's one of the important thing to be raised, the side effect, okay? Let's go to the scenario. Dr. Shaima Belidi, Mr. Ronald Stevens, yes, age 65 years. You are in the cardiology clinic. He has heart failure and you decided that would be suitable to enter double-blind randomized controlled trial looking at the effect of treatment X against placebo. This being carried out by your department as part of multi-center trial. Treatment X is a new anti-heart failure medication and is given in dose of 10 milligram once a day for 1 year. Previous phase 1 and phase 2 trial have only revealed rare side effects such as a rash, ankle swelling, and headache. The endpoint is left ventricular ejection fraction as measured on the echo. Your consultant is the main supervisor for the project in your department. At present, the patient is taking furosemide and ACE inhibitor, and he should remain on this throughout trial. Your task, consider Mr. Stevens would like to enter the trial and counsel him for this. Wallahi, very interesting scenario. Thank you, Dr. Aish. So they are bringing all scenarios. This, I think, this is from book, right?
Yes,
So why we are shocked by the scenario if it's already there and before?
because they like making
Yeah,
10 years, bringing it and then bringing
10
it doesn't.
years. Oh my God! But it's still there.
And it's not common.
Yes, yes. Yeah, yeah. I agree. Okay, let's do it. Very nice scenario. Thank you, Dr. Aish. 2 minutes, Dr.
But they
Shayma, then
bring
we'll start.
like someone, I think, in trial and they will, but it is the same issue.
The
They will
same concept, yes. The
issues,
same.
rules.
Yes. Anything related, it's okay. We are learning from anything, even similar scenarios. You might follow the scheme and hopefully you can pass. But for the first time, it will be shocking for you. What I will say, how I will follow, what I will discuss. So better to be discussed earlier before the exam. Whenever you're ready, Dr. Shayma, tell us.
اوكي يلا بينا نبدأ.
Okay, here you go.
Okay.
Good morning.
Good morning.
I am Dr. Zaba, the doctor in the medical OPD today. Are you Mr. Stewart Steven? 65 years old.
Yes, I am.
Mr. Steven, today we are here to discuss the issue related to your health. Is it okay with you?
Yes.
Mr. Stewart, Steven, can you please tell me how do you feel now?
Yes, I am good, doctor. I am on regular follow-up and I feel better.
Any complaint, any recent complaint?
No, just doctor. I am good. Just I become tired at the end of the day, but my daily living quite well and my usual activity going good.
Okay, Mr. Steven, actually I wanted to talk to you about something we do in our department, that we do a big trial in a new medicine for heart failure. This medicine we made previous trial on it, and it has a very low side effects. The side effects of this new medicine actually use skin rash and only ankle swelling and sometimes headache. Other than that, we didn't notice any side effects. Now, Mr. Steven, we do a big trial about this new medicine, and it may help a lot of people. Are you following me, Mr. Steven?
Oh my God, yes, doctor, but just I never entered in the clinical trial before. So I like the experimental rat doctor or what?
No. After we did trials on animals for many years and many trials, and we be sure that it is not harmful, we started to do this trial on people also. So we select people from our patients, and if they want, no one can force you in anything. If you want to be one of the candidates in this trial, actually, this trial, let me explain to you what is this trial. This trial we called in medicine double-blind, randomized, controlled trial. Don't bother yourself by the name, but this is we divide the candidate into two main parts. Each part, one of these parts take this medicine, and the other take take what we call the placebo. Placebo means like water, like something not harmful and not medicine. And we follow up them. If we follow up them for a period, which is 1 year. And then after this 1 year, we will do imaging in the heart and consider if this medicine improves their life, improves their quality of life, and we can produce this medicine to all our patients, or there is no benefit from this medicine. No one from the candidate know if he take what we call the placebo or the medicine. No one know. Only the
Why, doctor,
doctors.
like that? So you don't know what I'll take? I'll take medicine or anything fake? Why you will
Yes,
do that?
we do that to can judge the experiment at the end without any interference. If you take this medicine and you know it is placebo, it is not medicine, you will not take it. You understand me? You follow me, Mr. Steven? You will
Yes,
don't
doctor,
take it, and
yes.
you will make it important in your life. But if you take this medicine and you know it can improve your life, it can improve the quality of your life, it can improve your heart and make your life and make you live near normal life, you can take it, especially if it has a good effect. And we already regarding the unwanted effects, we already do the experiment on the animals many times, and there was no side effect rather than I mentioned to you skin rash and ankle swelling and some headache. And as we know, this unwanted effect is not necessary to be with every patient. It can happen or cannot happen, and even if happen, we can deal with it. And we will keep you under close follow up to measure your symptoms and to know your symptoms and measure the efficacy of your heart efficacy of your heart and the effect of this medicine in your life. If there is any other unwanted effect, we will deal with it. Even we can stop it at any time. Are you following me, Mr.
Yes,
Steven?
yes, doctor. It
And
sounds great,
think,
yeah.
think think about yourself. If it is good, it will add to you. And if and not to you only, it can be added to all patients. You can
So about the result
open
of this trial, doctor, they will like like being released, and or our
yes,
recording will be released and to
yes,
the
yes.
others.
After 1 year, we
No,
will
no,
do.
I mean, doctor, that our record and our participation, our health will be like uh, in hand of anyone. This result
No,
of
no, no,
this
no,
study
no, no,
released.
no. No, 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 no. This is study release with secret, and we can not write your name. We can make you a number to if you don't want to your name to be mentioned in this trial. No, it is confidential, and your all your information will be confidential, and we can also give you a number instead of your name. Patient number one, patient number
But I
two.
have any problem from this doctor. I will treat it also hospital.
Yes,
Will care about.
You will continue in the same medication, Mr. Steven. You will continue in your your medication. You take ACE inhibitor, yes, and you take also furosemide.
Yes.
You will continue in same medication, and you will add only this medicine. Okay, you may be in the group which who will take placebo. We don't know, but the action, this is trial will uh, will make us confident in producing this medicine after that to patients, and it may be additive for the treatment of the heart failure. And my team and my consultant and myself, I will be the one who will be responsible for this result, and I will follow up you regularly. If you
Okay,
have
what if I
if you have any problem, you can at any time you can stop this medicine, and you can switch
withdraw?
off from this trial.
Mm.
Yes, you can withdraw from this trial at any time. Don't be aware afraid from this. Don't
So if
worry.
I decide, doctor, to be not a part of this your trial, and I really
No
will
problem.
think
No
about
problem.
will affect
No
me.
problem, Mr. This will not affect our plan management at all, Mr. Steven. You are our patient, and we will give you best care and best treatment. If you want, it's okay. It's a good thing, and we are thanking for you for helping us in this regard. If you don't want to do it, it's up to you. No one can force you in anything. And be sure your treatment and management plan and your follow up will not be affected by acceptance or refusal.
Yes.
Mr.
Okay.
Mr. Think
Sounds
about
good.
it, Mr. Steven. Think about it, and if you feel ready, and if you feel wanting to help us, we will thank you a lot, and we can work together in this experiment. Okay, Mr. Steven.
2 minutes left.
Actually,
Yes,
Mr.
doctor.
Steven,
Yes,
we need from you, if you agree, we want from you to sign a consent. This consent is a written paper, contain all information we have discussed now. You read it carefully. Take your time and read it carefully, and be sure and sign it when you feel ready. And be sure if you want to withdraw this consent at any time, this is your right, and it will not affect your management plan. Okay, Mr. Steven,
yes,
are you
doctor.
following me?
Yes.
Okay.
Yes.
Mr. Steven, can I ask you some questions, please?
Yes.
What do you do for living, Mr. Steven?
I am retired, doctor.
Okay, Mr. Steven. With whom you are living?
With my wife.
Is she supportive?
Yes.
Okay. Do you smoke, Mr. Steven?
Yes.
How many cigarettes per day?
It's about 5, doctor. I really reduced my smoking after this problem in my
Okay, Mr. Steven, we advise you strongly to stop smoking completely. It has a very bad effect in your life. If you don't mind, Mr. Steven, I can help you by referring you to smoking cessation clinic. Think about it.
Okay.
Okay.
Okay, doctor.
Do you drink alcohol, Mr. Steven?
No.
Okay, Mr. Steven. Mr. Steven, do you want any type of support?
Thank you. Thank you.
Okay, Mr. Steven. I am waiting for your answer. Think about it and call me. I will give you my hospital contact number. And please, Mr. Steven, I will also give you leaflet and brochures about this type of trials and experiments. Read it carefully and call me to give me the answer. Okay?
Okay,
Or you
thank you.
can give me the answer in the next appointment. Okay. Thank you.
Okay,
well done شيماء.
yeah, time is
ما شاء
up. You
الله.
can start comment, دكتور شيماء.
انت عملت لنا التايم بعد كده بالماينس بس
Yeah, because
بدأ يعمل ماينس بعد ما خلصت.
okay, this
اوكي
is timer. Yeah, time down. Stopwatch.
يعني
Okay.
زودت على
اوكي
الكلام، زودت على الوقت.
no just a second. Okay,
Yes. Okay. Go
so
ahead.
well done شيماء. Just in the end, let's ask him what do you think about that, what's your thoughts. So he can say okay, or he can say I think, or he can rearrange another
انا عارفه
meeting.
والله،
But
عارفه
if
والله
he
يا
will
عائشة،
not
بس حسيت ان انا لو
uh,
مكانه استنى هبقى عايزه وقت يعني مع نفسي.
but he should ask because this is your discussion, and if he need time, okay. If he will uh, decide, okay, because it's your task, and you should explore what his thought. You can say, I need, because I have one concern, I need to tell my GB first and take opinion. So you said if already GB was informed about this trial to be in the same page with us. And yes, you can take opinion of anyone, and also tell your family. They can also share your thoughts with you. Okay. Okay. So
تاني كده عايش معلش، هو كان في كونسيرن عنده ان هو عايز يتل
GB.
الجي بي.
Yes. If you said to me what you think about our talking, what you think about this involvement in this trial, can you share me your thoughts, concerns? So he said, really, doctor, it is sound very good, and I benefit, and others benefit from it. So, but I need time to think, and I need to take opinion of my GP. Okay.
Okay.
What you will reply?
Okay, you can
Already your
say
GP will be involved. We will inform about your trial, and take your time, and be comfortable to take opinion of anyone, especially your family, to share your thoughts with them. Okay.
how we can how I know that his GB is involved.
Not involved. They said here in any trial, they will inform the GP of all the included in the trial, the one included, to be in the same page, because maybe he will go to the GP for any complaint or anything. So he should know that something in trial now. He should think about that effect of this medication.
يعني ده اصلا كده يعني.
This
يعني
is
انا
all.
كده
This
كده
is why.
بيفرض هو الجي. Okay.
Yes. So for him, this, as you said, first we will explain the trial. You can draw if you will find something like two groups, group A and group some will take, but we don't know which one will take the medication. The recipe you may say that like vitamin or sugar tablet.
بلاسيبو
It's like
الشوجر
sugar or vitamin tablet. You said like that to be explained more further, and it is really like that. Sugar in the most of cases, sugar. So you will take this medication for a year. You should say that it's for a year, but the follow-up not till the year. It will be close follow-up, and this is one of benefit of this study of the patient.
Yes.
He will be monitored by same doctor, but more closely than usual. Okay, more closely than usual. Okay, so this is one of advantage. Only this is the advantage for this patient. You will say it is your condition also possible improvement. This is also two advantage, but it is not a guarantee, because we don't know really you will take the placebo or the medication, and also is the medication still under study, and we just measure the efficacy of this medication. But you can get a benefit. Or about the bad side effect, reassure that you will regularly reviewed and explain that the drug been tested before, and the side effect is rare, and he will remain on all his medication that he already on. Okay. Okay, the participation is totally voluntary. You don't have to decide now, and if you decide not to participate in this trial, it is not altered our management in any way. And in any part also of this study, you can withdraw. And at this time also, it will not affect the future conduct of your treatment follow-up. This sentence is very, very important. This is, yes, you said, just, oh yes, you said it. Just to be in the early, like you said, I think in the last 2 minutes, I think. Or the end of, at the end of your talk. Just
يعني المفروض أقولها
let
أنا
it in different sentence and in clearly different in one to the examiner to be more focused on. Because if you included it in some discussion, a lot of talks, he may miss that you take into, you already tell the patient that. Just make it with a firm way or direct way to the patient. I need you to know that in start of talking, after ensuring you ensure about understanding time. In one time, stop and say this sentence because it is the most important here. So not let it besides the talks or included in long talks because maybe the examiner will miss it or something like that. Okay, just make it alone, sentence alone, because it's the most important point here. That is the participation to involuntary will not affect if he will refuse and he can withdraw at any time. Okay, this 2 points. Okay, if he asks you, he can ask which one will participate only. It is from many centers and a lot of ones like you will participate in this study. Okay, what is about the recording? It will remain strictly confidential. Recording will not publicable. And the result published by like reference number or code numbers. Okay. However, وهنا بيقول لك إن في legal obligation that the record and define identification بتكون بالrepresentatives of the sponsor الناس من السبونسر وكمان من registration authorities عشان يسجلوا الدواء ده بعد كده for recording of this medication in the drug list they should take this information the authorities. Okay, so you said this is a very
عايشة
restricted.
أنا مش فاهمة الحتة دي يعني أنا لما يجي يقول لي هو confidential بقول طبعا strictly
There
confidential.
is, yes, confidential, and it is will be published by code number. So here your result will be not published. Okay, this is your his concern, but there is legal obligation. I don't know if you should tell this or no, but rather write this. This is legal obligation that the sponsor and the authorities for drug they will review this information to make sure this trial is a real trial for this drug.
أنا المفروض أقول كده sponsor and
I don't know, but they said they write it. I don't know if it's any if it is we face this scenario and you remember this, said it.
Okay, well done, Dr. Shema. I have only one comment, Dr. Aisha, and also you can judge on this. Comparing us, as Dr. Shema said, yes, it was before done for the animals. The idea of mentioning animals, I guess it's not accepted. He will just compare himself.
They write it. They write it.
Really? So I will say.
Yes, but he said guayna big. Guayna big. And I think Shema will not
big is
understand
accepted
the guayna
because
big.
yeah, because they like the big, so we can say okay.
They like the big.
لا هي عائشة كمان لما سألت قالت لي أنا هو أنا ريتس دكتور ولا إيه؟
Yes,
like
but
rates?
I can say for me, if I will say, no, it's not like that. I appreciate your concern. It's not like that at all, and I will stop and close this topic.
We care about your health and we will not harm you.
Yes, I will not say
بتاع concern دي كده بس.
Yes, but I will not
we care
say
about
no.
your health and we will not harm you.
بص يا دكتور هو معلش يا
and
جماعة
we make this trial 2 times.
فيز 1 و 2 تقريبا في فيز 1 مش هو كذا فيز الفيز 1 و 2 كانوا على الانيمالز تقريبا.
No, but it's not good to mention to the patient that we did
فيز 2 ما بتبقاش على انيمال. فيز 2 بتبقى على small number of patients تقريبا 3-4 كده.
I am talking about even they don't need all these details. I mean, you can say it only we are trying now to do it in certain groups and they by their choice.
Just
If you
the
do it,
reply of this
yes,
sentence will be, don't you will not be like that. We care about your health and
yes,
we
yes,
will not harm you. Make sure that we will
exactly.
not harm you. Yes.
Yeah, no,
But
no
it
need
is
to say
written. One concern,
yes.
the
I
first
know
concern for him.
the concern, but the answer, Doctor Aisha, I'm saying, shall I say, yeah, before we were doing to the animal before starting trying it on the human? I guess this
No,
is,
no, not to
yeah,
say like that.
yeah, this is my point. So you just stop it, or you should close this issue and don't compare. Don't tell him it's not like the matter. I am sorry for your feeling. It's not like that. I appreciate your concern. We did this trial for human and we are doing it for the best interest for even for the population, not only for you, for the population. If the medication approved and the benefit approved, all human will get benefit from this medication, so you will get the reward from others that you started this medicine as a trial, convincing by this way. But I am comparing with this is my point, Dr. Shema. So you can accept or not, but I don't prefer to say no. It was tried before for the anime.
You are right,
Okay.
doctor. You are right. But yeah,
Yes.
but I think I said to him this because we already يعني, tried it and starting to be done in human.
Even if you did it, don't compare him to what happened
I
before.
didn't compare him. Yes.
Yeah, but you are saying we tried this on the animal before, so you are your turn now to try to this medication on you. This is the point. You got it. They
Yes.
are trying to keep the dignity and the welfare as much as they
Yes.
want, and they want you to do that. So don't try to put him in one sentence with animal. Yeah, for the dignity itself. Okay, is it clear? You got my point, Dr. Shema, right?
Yes. Yes. Yes.
Whatever, yes,
Yes. Yes.
most of the
Totally.
medication, yes, they are trying over the animal first, yes, but we can't
Yes.
say
Yes.
that to the patient. We can do it, yes, in the experimental life, but we can't say to a patient, yes, now your turn, we will do it on you to see the effect and the side effect and so on. So better not to mention it. This is my opinion. And Dr. Aisha also, she can say her opinion if she has any comment.
Yes, I mentioned all I think.
So agree, okay. Any other comment from others? Any comment, any question?
عائشة لو سمحتي بعتيهولي أنا قلت لك قبل كده
Yes,
بعتيهولي مش هكون
better to share it.
ابعتيهولي
Yeah, this is the
Yes,
first
I'll
time
share on the
بعتيهولي
group.
practice.
Okay,
Yeah,
nice.
thank you, Dr. Aisha, for the nice scenario, and Dr. Shema also for
She
practice
did
together.
even first time. It's a very good. Sam, you
Yes,
will
at
pass it.
least, Dr. Aisha, let me tell you, at least you talk about. Wallahi, I swear. And the stress, maybe your tongue will be freezed inside and you don't know what to say and what to talk. So try here to practice as much as you can because there the stress will stop you and the mental block also will block your knowledge, make your information like you will, inshallah, you will not face this, but try to practice as much as you can and to talk and to share and to comment because there you are talking subconscious, you are not thinking at all. With the stress you don't know what's happening there. After it's like sentence after sentence, minute after minute, finish the time you finish the exam, then the result will come. Really, that day will pass very fast. So try to be more confident and more practiced and more professional. This will happen with more frequent practice, inshallah. Any question or any comment for ending?
شكرا.
Yes, Dr.
Thank you
Hadir.
عائشة.
Yeah, thank you, Dr. Shema, Dr. Aisha. Yes, Dr. Hadir, really, the stress is very fatal. Sometimes you will say something which you don't want to say it. Wallah, even me, whenever I am telling you, remember this information. I'm always saying to you, please don't say frame time. Don't say I will stop you driving and you don't know the duration. when the doctor asked me for the neurology case, he asked me, "Will you stop this stroke patient from driving?" First thing came to my mind. I said, "Yes, I will stop him driving for 5 years." Why I said 5 years? I'm
اشمعنى
always
5
saying,
years؟
no, it's 1 year. I read it.
stroke 1 year؟
Yes, 1 year for then reassessment. Stroke.
Stroke.
Yes, I shared it
stroke
before. Yes, stroke 1 year, then to be reassessed.
Yes, you are the one sharing it before.
Yes, 1 year, not
stroke
5 years.
without treatment without residual weakness يعني
So it's
صح؟
initially 1 year. Yes, regardless, is it residual or not, he can do or not, it's 1 year initially. Then this is what I brought from Devla. I shared before.
TIA, how many?
TIA 1 month. Stroke 1 year. Remember rule of anyway. This is the concept here. Sometimes the sentence comes from your tongue without thinking, and always you are advising. Don't say duration. Just say to be reassessed or to refer him to
Yes.
Devla. But with the stress, wallahi, the information coming as you don't prepare. Yes, I will do like this. Even sometimes with the mental block, you don't know what this is scar for, and it's clear for splenectomy. When I examine the patient for splenectomy, there is a scar, mid-laboratory scar, and the examiner, there is no spleen. Logically, no spleen, mid-laboratory scar, it's splenectomy scar. Imagine what I said. I said this is a liver transplant scar. Of course, wrong, but he deducted me 6 marks, alhamdulillah, not more than this, because I answer other question. But I spend all the station thinking, what is this scar? What is this scar? What is this scar? When I went outside, it's a splenectomy scar. So whenever you are there, you are the stress is controlling you. Try to practice as much as you can, because there you are talking subconscious. You are not thinking at all. This is the last advice for today. Yeah, mental block and stress. Okay, thank you for today's session, Dr. Abdul Menaim and Dr. Intisar, Dr. Shima and Dr. Aisha. See you tomorrow, inshallah. If no more question, anyone has comment or question before ending? No question?
Thank you.
Okay, thank you, Dr. Aisha. See you tomorrow, inshallah. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.